I've struggled with this my whole life. Just made me so insecure. It's life-changing. Thank you, Dr. Lebowitz.
Good morning, Dr. Lebo, Gyno, and beyond. Saturday morning on this young man. He's from California, and he's 60. And I saw him about 6 months ago by FaceTime, obviously. He's from California. And I told him to lose some weight, and he did. He lost 40 pounds? 20 pounds. 20 pounds. Good enough. 20 pounds. And he looks much better. He does have a problem of loose skin. Now, a lot of doctors would just kind of, cut this out and give him scars from side to side. And you don't want those scars, correct? Yeah.
Right.
Yeah, you don't want those scars. Take the nipples off as free nipple grafts. And he'll look good, better in clothes, but probably never take off his shirt. So we're going to do it my way, which is Vaser high definition power assisted liposculpture, gynecomastia gland removal, and Renuvion J plasma for skin tightening. We're not doing a nipple areola lift right now because if I do aggressive lipo, Renuvion gland removal, I will harm the blood supply to the nipples if I do a lift as well. And I'm very safe and I want perfect results. So I feel it better to do the nipple lift, if he so desires, as a secondary operation. But with this, we're gonna hit him really hard with the Renuvion. Stealth incisions in the armpit, by the nipple, and inside the belly button. And I'll get down to the belly button and a little bit below, kind of right here, and we're gonna tighten this up as well. So we're gonna do the mid and upper belly along with the chest with the gynecomastia, gland removal, skin tightening, and everything. I don't think we're doing fat grafting. Are we gonna take some fat and put it up in there?
We are.
We are. Okay, great. So we're gonna do some fat grafting as well. So we'll take some of this purified fat and stick it up in there. We will use drains, most definitely, because I want to get a drain in there so I can sock this up so it doesn't fill up with any fluid. I don't want any post-op complications of any seroma. All that said, it's going to be done under local anesthesia. As I said, stealth incision in the armpit, by the nipple, and inside the belly button. So all that said, let's go. All right, so now we're going to frame him right here. Again, not going to do a nipple areola lift at this point. Fine.
Now let us begin by introducing ourselves. I am Han of Dime France, and we want to pump you up.
That sounds better. That sounds more like a horse going. All right, we pump you up. All right, guys, so young man from California, 60 years old, and we're doing Vaser high definition, power assisted liposculpture, gland removal, gynecomastia, Renuvion, J plasma, tighten everything up, and we're gonna do lipofilling to his pecs. No skin removal. He may need a nipple areola lift later on, but not at the same time because I can't do a good lift, and otherwise I would compromise the integrity of his nipple blood supply. So we're going to hold off on that till about a year, if he wants one. He may be absolutely thrilled with the results that we're going to give them just by this, without unnecessary scars or complications of blood supply to the nipples. Keep those intact. This, getting the midline here, protecting the skin, getting over and up under the gland. Get down to the first six-pack. I'm not going to give them a true deep six-pack that'll make them look like a Ninja Turtle. We don't want to do that. And again, through all stealth incisions here. There we go, separating this nicely. Oh yeah. Separating this, the gland from underneath the nipple, and if I do a nipple lift, I'll even separate even more blood supply to it, and we don't want that. Safety is the most important thing. Now be very careful here, get the tail of it, feel where I'm at. All right, so we got a good amount of fat out of this side, mainly the right side, and we whittled down these glands. So now we're going to get them out before we do a lot of lipo. But look at the difference between this flank and this flank. See the difference? Right there. So write 1,000 underneath the 2,000. So here we go. So I'm where I want to be. Okay. Good. So what I'm doing is really nice and freed up. So I call this a golf ball in a sock. So we're getting this golf ball out so the skin will retract. Plus we did the Vaser, plus we're doing Renuvion, plus we're doing fat grafting, plus we're going to put in a drain. Okay? Clean. It's a gauze for soak up the juices.
Just the suction. You have to?
Alright. Attach to the nipple. Bring it up. Nice. Almost there. Big muffins here. More. Right in there. Good. Righty. Alright, so now we whittled this. You can see it's just the gland just kind of hanging there. There it is right here, just wanting to come out.
Any pain, Carter? Nothing? Okay.
All right, so I'm dissecting the gland from its attachments right here to the under the nipple area of the complex. That's why I don't want to do a nipple lift at one time. Is I'm really thinning this out, and I'm very conservative in making sure there's no complications. I don't want him to have any problems with the vascularity of the nipple. This comes with experience. Done surgery for 30, 40 years like me. You've seen it all. And you kind of figure out what to stay away from. To learn what the patients to stay away from. Patients are red flags. Nice. Yes. So you see how it's attached right there? It's attached to this underneath the nipple. Bring it up, and I get the whole gland out. Because if you don't, it comes back. Whew. Almost there, still attached there. Now I use a quarter, I like scissors because I can feel I'm not burning any areas. There you go. That side too. Nice biggies. Alright guys, this is Renuvion. Powered by J Plasma. This is an amazing device for skin tightening. There's some new stuff coming out on the market, not tested yet, but we're going to be investigating everything new, everything great. Hi, baby dad.
Yes. What's your number here?
I don't know, maybe 5. Gonna tighten them up like a virgin on prom night.
Nice.
Dr. Lebo, Gyno and Beyond, 60-year-old from California. We did it all. We did Vaser, high definition power assisted liposculpture, gynecomastic gland removal, Renuvion J plasma. We did his chest, we did his abdomen, we did the sides. We etched, defined, and revealed all the muscles which are important for a masculine body, which includes the pecs, the delts, the lats, the six-pack abdomen. But with him, I wanted to make him flat. So he has a little hint of a six-pack, 2, 4, and 6, and the V to P, and the sides, and we even got to his back, all through stealth incisions, times 7 in the armpits, in the nipples, inside the belly button, and inside the groin. We have drains, closed drains, because we got a lot of fat out of them in the groin and in the chest. We left the belly button incision open. As I said, we did aggressive Renuvion J plasma for skin tightening. And finally, we did lipo filling to give them pectoral definition. Specifically, what do we put? Like 500 cc's in one side and like 480 on the other side. And the glands were huge. You took them away. Oh, here.
No,
Here are the glands. These glands are huge. Now remember, the importance of a good surgeon is when they get them out in one piece instead of like 5, 6 different pieces. I see that all the time. So this was the bigger side, and that's the smaller side. I think the right side was bigger, yeah. I think that's the right side, that's the left side. But they're out completely, never to recur. So we just finished this operation, perfect results. He'll be thrilled and he'll look amazing. Dr. Lebo, Gyno and Beyond, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Let's go.